Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Welcome to another episode of Modern Chiropractic Mastery. Today, I'm bringing you a solo episode. This one is going to be on patient communication, and I'm going to give you kind of my 5 aspects of communication. I do want to thank one of our listeners for this idea. She had messaged me on Facebook about this topic, and I know there's a lot of confusion or interest or lack of understanding of patient communication. You know, I think it also sometimes falls into that category of we've seen the big dog and pony show crazy patient communication report of findings where you got to bring all your family members and have a chicken dinner together to consider it good patient communication. And obviously, we're trying to avoid that. And so I think we maybe have gone too far the other way. It happens. And I'm going to try to bring us back to what is reasonable, ethical, elegant, patient-centered, and try to really get us our bearings on what effective communication is, right? And, you know, sometimes a lot of our evidence-informed chiropractors over-communicate, get real sciencey, real jargony, and it happens quite a bit. And so we got to avoid that. You'll fine-tune that as you come along, but you definitely want to find a happy medium to be able to really resonate with them and provide them with guidance when you do that. And I think a big part of it is leadership. And I actually posted this in the Facebook group this morning as I record this, which will be a different day than this is actually released. But, you know, I've really been trying to improve my leadership for my team, for my family. And for you, I think you need to also really improve your leadership for your patients. And one of the books I'm reading right now is called Be 2.0, and B is an acronym for Beyond Entrepreneurship by Jim Collins. Many of you may have heard of Jim Collins from the books Good to Great and some others, but years ago he wrote the original book with another author called Beyond Entrepreneurship. And so this is a 2.0 of it, updated, a lot of good new content in there. I never read the first one, so it's all new to me. But in the book, there's an excerpt in there, and I want to read this and then bring this back into patient communication because frankly, really good patient communication requires leadership from your part, and too many chiropractors are missing that aspect of it, okay? And so I want to read you a little excerpt from that book, and this is from Jim Collins. Quote, "I've been asked many times whether people can become a level 5 leader, and if so, how? Yes, and the best spark to ignite such leadership in yourself is to wrestle with a hard yet simple question. And that question is, what cause are you willing to serve?" And so he goes on, what causes are you willing to sacrifice and suffer for when you must make decisions that cause pain for yourself and others to advance that cause? What cause will infuse your life with meaning? It might be a grand, highly visible cause or a more private, less visible cause. What matters is that you lead in service to that cause rather to in service to yourself. And that last sentence there definitely resonates with me. I think a lot of us do things in service to ourselves and not to the cause. And as a healthcare provider, as a chiropractor, that cause has to be your patients. And to provide great leadership, it means to be patient-centered, not doctor-centered. I think if we took that last line, right, what matters is that you lead in service to that cause rather than in service to yourself. I think a lot of the chiropractors out there that are doctor-centered are servicing themselves versus the chiropractors that are out there that are really patient-centered are in service of a cause. And to be really in service to your patients and provide leadership for them, you have to communicate well to them. And too many of you and myself in the past, I don't treat patients now, but I've really doubled down on improving my leadership. And it would, if I was stepping back into patient care, I definitely feel I would have to improve on that in providing direction for the patients in a clear and concise manner. So I wanted to kind of lay some context of leadership before we actually dive into the five phases or aspects of patient care I think we as evidence-informed chiropractors can tackle effectively. Okay. And because a lot of it does take leadership. It can be nerve-wracking for some of us to communicate effectively and consistently with patients. And you might have to do it 30 different patients in a day, right? So it's not easy. And I get it. And that's where it kind of goes back to serving that cause and being willing to sacrifice and suffer for that cause. Like, you need to make sure you do the things to where you're firing on all cylinders when you show up to work with those patients. You need to be able to put aside some stuff that's going on at home or your personal life. Like, you have to be a professional. And to be a professional means you have to show up. And for a chiropractor, you have to show up for those patients and not kind of not be there fully and ultimately give them a second rate experience. You have to do what it takes to take care of your health, to be on and be able to show up for them. And then that's going to be the first step of really good communication, right? But we can break it down into 5 key aspects through that patient life cycle where you want to get really exceptional at. And it's going to take you time, but if you work on it, just like anything else, you will. You weren't a great clinician when you first started practicing. Now, if you've been doing it for a number of years, you probably are. It didn't happen overnight. So it's the same thing here. You can get better at it, right? And so that first one is going to be really starting at that history and consultation. I'm not going to sit here and kind of dive into all the details of a history and consultation that we learn and all the clinical side questions we need to ask. Like, that's a different topic. That's a different skill set other than what this podcast is going to do today, at least this episode. But there's something that I recommend chiropractors do, and it's a take from the R factor question from Dan Sullivan of Strategic Coach. And that R factor question typically is a 3-year time frame as Strategic Coach teaches it. Obviously, 3 years is a bit much when we're doing a history and consultation. So I've just switched it out to the end of this treatment plan. And so it would look like, after I've kind of done my basic history and consultation, I'm going to really face that patient and say, at the end of this treatment plan, what has to be the case for you to be happy with your results, right? Simple question. And then let them talk and let them say what it is, right? Because they may have come in with the knee pain, but it might be they want to run that marathon, in 6 months, or it might be the headaches that they came in with, but it might be impacting their work, right? We want to really get down into what brought them in and what does success look like for them. And it obviously, there's probably going to, in many scenarios, be pain as part of it, but it's going to be the next level and getting them to achieve something that they're struggling with right now. And that's typically what brought them into your office. Okay. And so we coach our clients on that as a big question to ask during that history and consultation. Okay. Now, the second part is going to be the report of findings. And that first question on that history and consultation, that R factor question, is going to help set you up pretty well. And report of findings, in my opinion, either needs to be done at the end of the first visit, or if you decide to do it at the beginning of the second visit, that's fine too. But it really only needs to be about 3 to 5 minutes to be effective, and then guide them on that, right? And a really good report of findings is going to be clear, and it's going to provide them with a full understanding. It's not going to be a sales job per se. I think a lot of us have a misconception, or rightfully so, that a lot of times when someone says report of findings or review of findings, it's like, oh, here we go. It's trying to get this person to buy a car from me type of deal. And that's not the case. So I want you to sit down in front of that patient, really not be distracted, and provide them with a handful of things. And let me kind of go into it. As a framework, I like to use Donald Miller's story branding for the report of findings. And if you remember, you're going to have the hero, which is 1, okay, the character. That's going to be the patient. They're sitting in front of you. And 3 is going to be introducing the guide. That's you. So, 1 and 3 are taken care of in this situation. but 2 is the problem. And this is going to be the essence of your report of findings. And if you recall, and we've done episodes on this before, and we've had John Morrison on our podcast, who is certified story brand coach, and I know a lot of the messaging, and we coach our clients on this report of findings as well, is that you're going to have the problem, and it's going to break down into 3 aspects, right? The external conflict, the internal conflict, and the philosophical conflict. The philosophical conflict is not, philosophical chiropractic. So put that aside. The external conflict is in how it relates to chiropractic. That's going to be their diagnosis, right? Let me what they came in with, like my knee pain, my headaches, my shoulder pain, whatever, right? The internal conflict is going to be, what's it really impacting, right? So it's that mom that is having a lot of pain and it's impacting breastfeeding, right? And then it could be that runner that can't run and they've got that race coming up. That's what, a lot of times people will deal with pain or dysfunction or, being uncomfortable. But then when it starts to impact them internally, that's when they say, okay, I have to go see someone. And then the philosophical conflict is going to be, all right, they got to go see someone. Who the heck are they going to go see? And why are they going to see you? All right. And so we're going to, I'll give you an example of that in a minute, but that philosophical conflict is like, okay, yeah, I don't want to go to an orthopedist for this because he's going to tell me I should never run again. Or I don't want pills or surgery or anything like that. I don't want to spend an hour doing physical therapy exercises. I need a little more efficiency of care. I want some manual therapy that's going to really fix the issue, things like that. All right, docs, here is a new opportunity for you from Darcy Sullivan of Propel. She is our SEO specialist in helping out many chiropractors with their search engine optimization and making sure Google is finding you and getting you new patients. It's amazing how many new patients chiropractors can get and are getting when they do the SEO right and a few other things. And Darcy is offering a free SEO workshop just for chiropractors, and you can sign up for that at bit.ly/propelmcm. That is bit.ly/propelmcm, Modern Chiropractic Marketing, right? And so check out that link, and we're going to have you go over 5 SEO secrets to owning the first page of Google without buying ads. And Darcy's going to give that free workshop, 1 hour, to really help grow your practice and start churning new patients from the ever mighty Google, which is still king in the online marketing. So check that out at bit.ly/propelmcm for the 1 hour free workshop. And so that's going to be, part 2 of the story, which is the problem. Again, we mentioned what 1 and 3 was. 4 is the guide has a plan for them. So that's going to be your treatment plan. 5 is you're going to, call them into action. That's going to be them scheduling their visits out. That's going to be them actually doing the homework you give them. That's going to be them agreeing to your treatment plan and saying they're on board. That could be things like them, buying a treatment package of 8 visits, for the entirety of the thing, whatever it may be. There's certain things I would say, okay, yeah, we're taking action. And if they take action, there's a higher chance they're going to avoid failure and lead to success, which is 6 and 7, right? And I think a lot of people are always concerned with the report of findings because avoid failure, which would be number 6. Some chiropractors hammer that hard, right? Like put up the X-ray and say that they're not going to be able to walk if we don't level out this pelvis. So they're tripling down on the failure part of things and try to avoid failure. And it's a scare tactic thing. So we're not going to do that, but we're going to paint a picture of what success looks like, and they'll be able to deduce that they have a higher chance of avoiding failure. All right. And so let's actually kind of dive into what that looks like a little bit. Right. And so let's just imagine a scenario. You do your evaluation. There's no red flags. You don't need advanced imaging. You can treat them in your practice. There will be situations where that's not the case, and you know how to have that conversation. But let's say, for the sake of this and not making it a 2-hour podcast episode, we have no red flags. We don't need advanced imaging. We don't need to refer them out. We can treat them here, right? And so this is what it would look like. Hey, Sally, I'm got done with all the evaluation, treatment, everything. I really appreciate your time today. Good news is in our evaluation process, I didn't see any red flags. We don't need to send you out for any advanced imaging like MRI or anything. And we can treat you here. So we don't need to send you out for referral to an orthopedist or any other specialist. I feel very confident that we can treat you and get the results that you want. You stated that you want to be able to run that marathon in 6 months. And I'm confident that not only can we get rid of your knee pain, but we can also get you to be training and running appropriately to be able to compete in that race. And so that's going to be our goal. And when you come in here, we're going to use that as our measuring stick of your improvement, is to not only get rid of your knee pain, but improve what caused it and get you to back to running as soon as possible so that you can run this race. Does that sound good? They'll probably give you a yes. They'll be happy. I would have given their diagnosis. So you would want to plug in, it's like IT band syndrome, or whatever you want to call it for the knee pain. But you're ruling out any red flags right now and give them their diagnosis. That would be the external conflict. The internal was me restating their R factor question of running that race. And the philosophical was that they don't need advanced imaging. They don't need to be referred out, and we can treat them here, and we're going to get them back into running. So I really address some of those concerns they're going to have, right? And so that's going to be really summing up that problem there. Then you would roll into your treatment plan. And this is kind of me going back to that. Okay, great. And so based on my evaluations, your goals, and my past experiences with this, I typically need to see someone 2 times a week for the next 3 or 4 weeks for this. And when you come in, we're going to do some active release techniques, some rehab exercises. There's some things we found in the lumbopelvic region that we're going to probably do some chiropractic manipulation there. And your visits will be about 15 to 20 minutes when you come in. Today was a little bit longer because we had the evaluation, history, and consultation, as you know. But when you come in, we're going to be able to get good results efficiently. And we're going to give you some homework to do to make sure you really expedite this. So I want to make sure you can keep up with that. And we're also going to have conversations as you come in on your improvements and what we can reintroduce as far as activity to get you going. And so that'll be the plan. I need you to just make sure you do the homework we give you and, obviously abide by the advice that we do as far as the running, and then we'll be able to go from there. Does that sound good? And so I try to get them in agreement with what our treatment plan is. And so I touch base on the length, frequency, duration. I touch base on what we're going to be doing, how long it's going to take, just trying to give them the nuts and bolts of it, because I don't want them to think it's going to be 45 minutes every time if it's really only going to be 15 or 20, because some people would value the 45 and they'll be frustrated the other visits aren't. A lot of people aren't going to value 45 minutes every time they come in. They're worried about their calendar and do I have to be here for that long every time? And so we're really being clear on what for them to expect, also on some of the homework that they're going to have as well, right? And then, just kind of let them, I ask at the end, I just said, do you have any questions for me? And I try to answer some questions. If it's someone that's very long-winded, you have a skill set to kind of mitigate that a bit and get them to your front desk. And then you need to have really good communication between you and the front desk on what their treatment plan is. And I like to do that in front of the patient, bring them up. I don't bring every patient up to the front, but the new patients I will, and make sure that everybody's in agreement on that treatment plan. And that to me is a very effective, there's more to it, but you get the idea of a very effective, concise, providing leadership type of report of findings. All right. And so that's the second key aspect of it. Now let's move on to the third. You're going to see this person 2 or 3 times a week, and there's going to be a lot of communication there. Some people will call that table talk, but ultimately, you're just going to have your communication. I think you should, when you have your regular follow-up visits, during your palpations and assessments and all that, let them know what you're finding. Let them know what improvements are. But I think this really becomes an opportunity for you to just be yourself and communicate with them in a social way that's reasonable, right? Like professional, but social, and getting to know them and, them getting to know you within reason and just building that rapport and that trust and getting to know each other, and utilizing that to have just good conversation. Because you'll be surprised, for you, it gets lost in it because you'll see 30 of these and it's another conversation. But for them, it might be the best 10-minute conversation they have throughout the day, including going home to their spouse sometimes. And so it's a big part of it, but I do think you need to give them progress updates without overwhelming them each visit. And then ultimately just having good conversation for the length of the visit, right? And so that's the third opportunity, as we know, for communication, right? Now, moving on to the fourth one, I'm not going to spend a lot on that third one. That's kind of a whole thing there, but it's definitely important to um, have good conversation with them. Okay, so I'll leave it at that. The fourth one, and the next couple are where people kind of miss the boat sometimes, and that is the fourth being when the pain is gone, right? So we have this ironic aspect of our evidence-informed clinic where we're very, and I've harped on this before, but we're very movement-based and function-based, and we want to find the cause. We don't want to chase the pain. It's not about pain. But then we treat our patients, and then when they're out of pain, we use that as their measurement for success in releasing them from care after a few visits, right? So that's a tricky situation. I think a lot of evidence-informed chiropractors have gotten themselves into, and the thing they fail to realize is that if you didn't actually solve the issue, there's a lot of times it comes right back in a few weeks to a few months or whatever, and you didn't really solve the problem per se. And so I think a really good treatment plan is going to be designed to not only get rid of the pain, but also restore function and give them the tools they need from a corrective rehab standpoint at home to keep on working on that injury resilience, right? So if you discharge them after 3 visits, there's a couple things that are probably short-sighted there, probably more, but at least 2 is one is you most likely didn't correct the dysfunction that led to the pain or the movement pattern issue and all the other things. And then 2, there's a high likelihood that their capabilities of doing the rehab, the at-home exercises is not there, and they're doing it wrong, or they're not really ingrained in doing it. It's not part of their routine yet. And so they're not going to do them, or they're going to do them incorrectly. Right. So that's some of the shortcomings there. And so I think it's wise to lay out a treatment plan that talks about pain, but also function. And what we've done in our practice is, and we've even named it the HealthFit Approach to care. And it's 3 phases. One is, pain relief. 2 is return to function and injury resilience. And then 3 is performance care. That's kind of our form of wellness care, which we'll get to in a second. But we go over that in a report of findings as well during that kind of part where we go over their treatment frequency and what to expect. So I didn't interject it into that spiel I did earlier because I wanted to introduce it now. But you could inject that into that aspect there of I'm going to see you 2 times a week for the next 4 weeks. And in that, our goal is to get through phase 1, which is pain relief, and then get into phase 2 and really make sure that we're improving the function and movement quality and giving you all the exercises that you need to do them correctly at home. And that will help with injury resilience. And so we talk about that in that report of findings. So then we fast forward, and that patient comes in on visit 3, and they're like, "Hey, doc, this is great news. I'm feeling great. I have no pain. I was able to run. I'm doing well." That's when you have to sit down with them and have a quick little conversation. You could even we have our phases of care is laminated in the treatment rooms, and say, "All right, perfect. Remember when we sat down on that first visit and we talked about in your care plan is to get rid of pain, but then also return to function and injury resilience? We can graduate to there now into this phase 2 of your care for the duration of your treatment plan. And if all goes well, we'll be able to release you from care on time like we were hoping," right? And so having that conversation and getting them in agreement with that and realizing that they're not done yet. Now, if they are, in your clinical expertise, and they're full return to function, they're killing their exercises perfectly and all that, so be it. But a lot of you are not doing that, and a lot of you are not leading them in this manner and making sure it doesn't come back, or at least have, obviously, nothing's 100%, but a less likelihood of coming back. And so you need to sit down with them at that transition from pain to now we can focus on improving the function. I can add certain treatments and exercises. I couldn't do before because of the pain. Now we can have fun with some of this stuff and get to the root of it without flaring up the pain that you had. And so those are the key things you need to touch on that one. All right. Okay. And then lastly, let's fast forward and say we're at the end of our treatment plan. You do your final examination. You're going to release them from care, which is great news. This is a great opportunity for you to sit down and talk about optimal performance care and kind of being the training room for their life and being able to keep up with their body just like an athlete would. And, that's going to look different to everybody, but it could be, if they're in, let's take that runner, right? And you got them better, but they still have 4 months left before their race and they're going to be training hard. That person, and they may choose to come in once a week just to stay on top of it. They're putting in a lot of mileage and they have this previous injury and they don't want it to come back. There's nothing wrong with recommending they come in once a week until their race or maybe every other week. I'll let you use your clinical decision on that. There's nothing wrong with that. If they don't have anything big coming up and they just want to stay healthy, but they're exercising and they're staying fit and all that, maybe it's once a month, but you're putting out fires, you're checking some things, you're just making sure that they're staying on point and they're performing well, just like a high-level athlete would, right? And so performance care is not a dirty word. I know wellness care, maintenance care has got kind of that derogatory stigma to it, but I like performance care, whether it's performance in work life or athletics. And so having that conversation with them, not hard selling them, but a lot of them will be in agreement with you on that, and they want that in their life, and they definitely see the value. And when that's the case, then I recommend, again, that's another visit. I bring them up to whether they want to or not. When we're done and we're releasing from care, I love to walk them up to the front and let front desk know. It's like, Greg's doing phenomenal. He's fully recovered. We're releasing him from care. And then if he does, but he wants to stick with optimal performance care. And so he wants to do once a month. Can you get him on the schedule for a month and get him on the schedule for the month and make that part of their routine. Right. And that really kind of summarizes, I think, very effective care. You need to fine tune it. What I went over today isn't all the things we go over and really fine tuning it, but you get the framework and understanding it. But I think this is something that we try to really work on with our coaching clients, is because it can really move the needle in your practice very effectively. And because communication is just lacking in almost all aspects of life, and I'm seeing it a lot. And I, experienced myself. I got better over the years, probably could get even better, but I think it's something that we all need to improve on to provide leadership for our patients. Good communication is going to really help them adhere to their treatment plan, follow through, and get the results that they desire and that you desire for them, right? So work on that, build out your framework, improve, role play if you need to, but get a lot better at communication, focus on it, and I have no doubts that you will. I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.